As you get older, it is really important to keep a medical history document. You may think to yourself, oh, I'm not going to forget when I had my colonoscopy, or when I had a particular surgery, or the age at which my mom had breast cancer. But over time, it really becomes harder to remember those dates. And it is so nice to have all that information in one place when you are filling out forms at the doctor's office. I personally keep all my information in a Google Doc that I can use to reference, but you can keep your medical information in a note on your phone or even, hard copy, like in a notebook. Things that you definitely want to include in your medical history document are your medications, including the name, dose, and frequency, your surgical history, and your family history of things such as cancer, high blood pressure, and diabetes. You also want to include the date of your last blood work and any abnormal results, and the date of your last colonoscopy. For females, you also want to make note of your last mammogram, your last pap smear, and your birth history, including the birth weights of your children and their gestational age when they were born. If you had an MRI, CAT scan, or X-ray that showed abnormal findings, I would also make note of those findings and the date of the imaging test.